So, good morning, everybody. It is a great pleasure for me to be here in this webinar with such a distinguished panel, of course. And now I have the pleasure to address this topic about the characteristics of this brand new 7.5 Pusen single-use ureteroscopes. Before going into details, it's important to keep in mind what do we want from a flexible ureteroscope. We want vision, a combination of these features: vision, maneuverability, small diameter scope, durability, and of course, last but not least, cost effectiveness. If you look to this first prototype of flexible ureteroscope, thinks that it dates back to the late 60s. It was before the semi-rigid advent of ureteroscopy. It was already a good view, an acceptable view scope, but without any kind of maneuverability. So at the end, it was almost completely useless. And we had to wait at least 2 decades for the first generation of STORZ Flexi C, in which they were able for the first time to add to a good vision also a good maneuverability. Then all the company were able to manufacture different model of single-use fiber optic scope, and all of them were able to open, let's say, the era of flexible ureteroscopy, because they were able to guarantee a good vision, a good maneuverability, and also a small diameter that basically rendered all kinds of flexible ureteroscopy possible. Then there was the feeling that the vision was good, but for sure improvable. So the company were able to improve the quality of video by adding more fibers into the bundle. So they passed from less than 5,000 fiber optics to more than 5,000. And as you can see, the quality of vision improved consequently. Then, last generation of fiber optic, actually, they are able to put more than 8,000 fiber optic inside the bundle. But once, for the first time, we saw the quality of a digital view. Of course, this was definitely a breakthrough, because once you are used to such a good quality, it is not easy to go back to the fiber optic quality of vision. So, basically, this was the first scope to be put on the market with a very good quality of vision. But this is a critical point. This is a good vision scope, but here happened something that I didn't like a lot, because to have a progress in terms of view, we have a regression in terms of diameter of the scope. And I think that this is an important point. When we have a real progress is when a progress is in all fields, not a progress in one aspect and a regression in another aspect. So even though the quality of vision of this Olympus Wolf V was very good, but look at the diameter, 10.9, was a very big scope. So better vision, but the diameter was too big. That's why, for example, Dr. Grasso, who is one of the kings of flexible ureteroscopy, was not in love with this first generation digital scope, because he couldn't accept this, let's say, step back in terms of diameter. And he couldn't accept to perform flexible ureteroscopy with such a big ureteroscope. Then the evolution continued, and all the companies were able to deliver good quality digital reusable scope with small diameter. So as you can see, all the companies were able to deliver very good vision, very good maneuverability scope, and also with acceptable small diameter scope. But then there was another problem to face: the fact that all these reusable scopes were very, very fragile, and the durability has always been an issue. So again, all the urologists started to have this feeling that maybe a real breakthrough could have been the introduction on single-use ureteroscope. Again, in this field, there was, let's say, a strange progress, because the concept was a step ahead, but this first generation prototype of single-use ureteroscope were not able to deliver a good maneuverability and also not acceptable quality of vision. So again, a step ahead in terms of a concept, but a step back in terms of quality of vision. But we have to, honestly, to be thankful to Boston Scientific for the real breakthrough that they were able to deliver at more or less 2015, when they first introduced the lithoscope. Immediately after, also Pusen put the first generation U-scope on the market, and so subsequently all the other companies went on the market. And actually, from this generation, we can say that all the reusable scopes were able to deliver very high quality and similarly quality view from the scope. Because, for example, if I ask you, doctor, to recognize which scope is the one on the left and the one on the right, is almost impossible. As you can see, the quality of vision is very, very similar. So we can say that starting from this period, where the companies were able to deliver a good vision and maneuverability single-use scope, but again, there was another problem. These scopes were too big. Because if you compare all the single-use ureteroscope, on the market up to now, when the fiber optic and with the reusable counterpart, you can realize immediately that there is a significant discrepancy in terms of diameter in favor, of course, of reusable scope. But this problem, we can say today that this problem has been definitely solved thanks to the introduction of this brand new 7.5 ureteroscope from Pusen, because as all of us know, is a 7-point French in diameter, which is actually the smallest scope on the market. And this is the most important feature that we are going to appreciate. Talking about the characteristic, first of all, packaging. This scope comes with an outer carton box, which is very small, and which contains an inner blister, as you can see. And now let's try to recognize all the features of this blister. First, this is the certification that the sterilization of the scope has been perfect. Then there is also this label on both external and internal box, in which we can recognize the expiration date, the reference number, and the type of deflection, reverse versus logical American deflection. And last but not least, to keep in mind that this is a single-use scope that should not be reprocessed. What I like a lot of this box is that it is very small compared to the competitors, and it is very easy to find a place in our endourological chart in the OR. So it's very easy to have always this scope close by when you are operating in difficult endourological procedure. Talking about the monitor, we have two options with this scope. We can connect this scope with the dedicated Pusen monitor, that it comes with an 8 GB internal memory, and it is supplied with all the different connections available actually on the market, so that you can operate like in this picture, just watching the monitor, or you can also connect the monitor to your standard endourological tower. It's up to you whether you prefer to do in one way or in the other. Usually, I prefer this if I operate only with a flexible ureteroscopy, while I prefer this other combination when I perform endoscopic combined intrarenal surgery. The second option is to use only these image processors. That is, it will be available on the market very soon with similar characteristics. But the advantage of this is that it is very small, and it is always very easy to find some room on our endoscopic tower in order to connect this image processor always with our endoscopic tower. So leaving some room in our OR, because of course we don't need a second monitor to be connected. What about illumination? The innovation of this last generation 7.5 Pusen scope when compared to the first generation one is that the illumination comes with a double spot. And this is supposed to deliver a better illumination, reducing shadow areas that sometimes are a little bit a problem when for single-use scope when compared to reusable scope. What about the handle? The handle is a very ergonomic, and it comes with 2 buttons, and by pressing these 2 buttons you can control by yourself while you are operating in order to record pictures and video. And of course this is a very useful features that for our educational activity. And we have also a working channel with a lure lock connection where we can connect our irrigation system, in which in this case is a recommended flow system that is my favorite, but it is compatible with all kind of irrigation system. Talking about the working channel, this scope is supplied with 1 single working channel, 3.6 French in size, like the majority of the scope on the market. And the orientation of this working channel is 3 o'clock, as you can see from this picture. What about the deflection? As reported in the brochure of the scope, the deflection is at 270 in both directions, and I can confirm that it is definitely true. I would say that it is even a little bit more than this. And as shown in this video, this deflection is more than enough to guarantee a complete navigation of the all upper track collecting system. And this is definitely an advantage of the scope, because of course, when you have such a robust and effective deflection, of course, the navigation of the entire collecting system can be guaranteed. Another feature that is definitely in favor of the new Pusen 7.5 is its lightweight, because if you weigh this scope, you realize that it is less than 200 grams, and it is much less when compared to the Boston LithoView. And of course, the difference is even bigger when you compare to standard usable scope. And as we have already heard in the previous lecture, this is definitely an advantage, especially for long procedure where to hold the scope with the camera connect can be very, very hard for a surgeon, especially if a surgeon, for example, is a female, like my colleague, Dr. Proietti. And also the dimension of the handle is very ergonomic and suitable for all dimension hands of different surgeons. Well, talking about this reduced diameter, of course, the advantage basically is that it fits into all kind of ureteral access sheet on the market, especially on the Cook 9.5, that is the smaller on the market. In this video is a ureteral access sheet from Rocamed, which is bigger than 9.5 because it is a little bit more than 10 French, but it was clear that the outflow was always guaranteed during the surgery. And as you can see, these, as you might know, this good outflow is one of the safety rule to perform a long surgery, because only by doing this you are sure that what you are introducing is also coming out, keeping the pressure under a safety threshold, I would say. What I like a lot of the first case that I performed with this 7.5 is that this very small diameter scope allows you to incannulate the vast majority of the ureter directly with no guide wire, like in this video, with a kind of no-touch technique. And this is very, I would say, useful during the surgery. and actually has changed a little bit the practice in our department, because also for flexible ureteroscopy, we start directly with the single-use ureteroscope without using any longer the semi-rigid ureteroscope. And also, this good feature of this scope is changing also the way we treat stone in the ureter. Since it is so easy to get access to the ureter, actually with this scope we are treating also the vast majority of ureteric stone with flexible ureteroscopy, just because it is very easy to enter the ureter, to go back, to remove fragment, as you see in this video. And I think that maybe another change in our practice delivered by this scope could be also to treat the vast majority of a ureteral stone by means of this single-use flexible ureteroscope. And of course, in difficult ureters, this reduced diameter is another useful features. And in this difficult case, there was a difficult stenosis. We can accelerate a little bit. And there was no way to introduce a ureteral access sheet because of this stricture, but by forcing a little bit, but most importantly, using this small scope, it was possible to pass through this stricture, and for sure, it would not have been possible with a bigger diameter scope. Also, in edges, of course, is an advantage, because this is our preference to use a single-use scope during this complicated procedure, just to avoid to break our reusable ureteroscope. So the definition is good enough to perform a good surgery. Before, I asked you to recognize a little view from the first generation Giusti, and now I ask you to recognize the quality of vision before the first generation, the second generation Pusen scope, the new 7.5, and as you can see, the quality is just the same. So this is a great step ahead in terms of reduction of the diameter of the scope, but keeping the same quality of definition. And this has been demonstrated also in this paper by Dr. Desai from India, that were able to demonstrate that the quality of the scope is just the same, only the diameter of the scope is reduced, and this is definitely a step ahead. If we want to find a drawback in this scope when compared to the competitors, is that some competitors has a higher definition and higher definition vision, but of course they come with a bigger diameter. So in conclusion, I will say that it was the reduction in diameter of our scope was the most urgent need for the modern endourologist. And we have to be thankful to Pusen for this innovation, because I do think that sometimes a little lower definition, but with a very close view, can be better than a higher definition view, but from very far behind, because you were not able to get into the kidney. So I thank you for your attention.
Thank you, Guido. It's a beautiful, beautiful description of this new 7.5 single-use flexible ureteroscope. I think all the characteristics, you very well describe all the characteristics and the differences actually regarding the different scopes available. Just two quick questions, Guido. The first one is, we said we still say that fiber optic endoscope, there's still a place just because they are smaller than the regular digital one, and this is one of the recommendations actually to keep fiber optic endoscope due to the small size. It seems today that with the introduction of this new Pusen 7.5 French, that these advantage will disappear. So do you think actually that this is definitively the end of fiber optic, since now we have digital one and as small as the fiber optic one?
Well, Olivier, it's difficult to say whether it will kill fiber optic. I think that it is going to be very, very likely because actually this very reduced diameter guarantee the navigation in the vast majority of collecting system. Maybe the deflection of the very terminal part of the scope can be still a little bit in advantage of a fiber optic scope. But I think that this is not going to be enough to keep our fiber optic scope. Honestly, Olivier, I don't know about you, but actually I'm using fiber optic scope very, very rarely. And I ask only my young colleague to use them. Actually, I use only digital.
Yeah, I think that's we have the same experience. And my second question, Guido, for you, you mentioned that now you are able, with this 7.5, you are able to treat ureteral stones, meaning probably that you are not using so much semi-rigid or rigid ureteral scarp. But my question is regarding more emergency ureteroscopy that we can perform in emergency. You know, we have to drain patient by placing double G for some renal colic in emergency. Do you think today that unless we place a double G, we can maybe imagine to place directly a 7.5 flexi ureteroscope and to treat the stone and not place a stent and to wait for the treatment of the stone?
You are definitely right, because if we think it over, the dimension of this scope is more or less the dimension of a stent. So for sure, this is really possible. And actually, as you might know, we moved to the main San Raffaele hospital. Now we have a first aid section. So this is very important to have this new possibility, also because when we operate in the emergency OR, we have just to bring our single-use scope, our little monitor, and also for the nurse team of the emergency OR is much, much easier to assist us when compared to a standard endoscopic tower. So this is definitely a possibility in the future. And again, we have to be thankful to Pusen to have developed such a small diameter scope.
Okay, thank you, Guido. Again,
thank you.
excellent talk.